Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, I'm excited to be back with you talking again this week about our Gold Midwifery Online Conference 2026. It's right around the corner. And of course, I have the pleasure of introducing some of our amazing speakers to you. And here we have Dr. Kate Levick, who's here with us today. Welcome, Kate. It's so good to have you here at Gold Midwifery.
Thank you, Fiona. It's lovely to be here, and I feel very honored to be part of the speaking lineup, the fantastic lineup of speakers you've got for this conference.
Aw. Well, thank you. Yeah, I mean, I'm so excited about all the topics this year. We're just taking sort of another deep dive into some of the things that maybe aren't well looked at, don't have time to look at, and just really changing that clinical practice. These are the things that are going to be able to put into the hands of those midwives so that they can change their practice right away. And I know you're going to be talking about something really so interesting. We're starting to see it, I think, show up in different places. We don't know a lot about it, but you actually do, which is fantastic. Managing POTS during pregnancy, empowerment through quality care is the topic of your presentation. So I'm delighted that you've been able to, put this all together for us. So in your research, it really centers around these lived experiences of women with POTS. And this might be something that people haven't maybe not seen at all yet. We talked about that a little while ago when you and I were getting all set up. So tell me what led you to focus on pregnancy in this population, and what did you hear from women that felt especially important to bring into midwifery care?
Great question, with a few different answers, I suspect. So, POTS is, depending on where you are in the world, still fairly under-recognized and very
Hmm.
misunderstood. And what we do know about POTS is still in the general diagnostic kind of realms when it comes to POTS and pregnancy. There's
Right,
still almost nothing out there research-wise.
right.
Um, so I'm a registered nurse. I'm not a midwife,
Hmm.
but I absolutely love midwives, and midwives do an absolutely fantastic job at caring holistically for women, which is so, so important to look after the whole person and their personhood. We know that that not only helps them as they transition into motherhood, but it gives the baby the best start in life. So
Right.
I initially got interested in POTS and pregnancy when I was a student nurse, and I was
Oh,
working in a
wow.
NICU, and this baby came in and basically was absolutely healthy, and the mother
Hmm.
was being punished because she had this uh, condition that was inconvenient, and the obstetrician was complaining. And I thought that was absolutely ridiculous and completely unfair, and couldn't understand why a woman who, even though she couldn't sit up without fainting, why can't you cuddle your baby and nurse lying down?
Right. Yeah.
So we took the baby to the mum, and I will never, it makes me feel teary just thinking about it. I
Yeah.
will never ever forget that moment. And
Wow.
that really sparked that interest.
Hmm.
And when I started looking more into POTS, so my clinical background is coronary care. I'm very interested in electrophysiology, how the heart works,
Right.
um, and very, very passionate about women's health. So I
Hmm.
started looking more into it and realized that there was no research. And
Oh, wow.
as a clinician,
Yeah.
I figured the best place to start was to ask women themselves what they wanted to know. And
Yeah.
I've been in this space for a bit over a decade now.
Yeah.
Um, and every woman that I've spoken to,
Hmm.
without a doubt, has told me that they've been scared, that they don't know what is going on, that their doctors don't know
Mm.
what's going on, that they are
Right.
probably going to be high risk, that they probably need a cesarean, that they can't even have babies. I had one
Wow.
woman tell me that her doctor said, "You'll have a heart attack because of
Mm.
POTS if
Right.
you try and have a child." And that made me really sad, um,
Mm.
because I think that everyone should have that opportunity if that's
Right.
what they want to do. So it might be more complicated. It might not
Hmm.
be, but how
Hmm.
can we work around things so we can give women and birthing people the best opportunities that we can so they can succeed and achieve those dreams? Because it is an
Mm.
achievement. We really need to celebrate. pregnancy and birth
Sure.
for the absolutely amazing miracle that it is.
Yeah, absolutely. Yeah, I can see that that was a loaded question for you. You just try
Yes.
to, there's a lot going on here.
Yeah, sorry,
I
long
guess,
answer.
no, no, no. I mean, that really lends to the fact that, yeah, I mean, there's a lot to talk about. There's a lot to unpack, as they say, in terms of what is happening here. So is POTS common, not common? Like explain to me, it's a common condition or is it just not diagnosed commonly? What's the essence of POTS right now?
It is the most common condition you've probably never heard of.
Right.
Um, so it was and still,
Yeah.
unfortunately, is thought of as a rare condition,
Yeah.
but it's not rare. It is pretty
Ah, yeah.
common. It's more common than multiple sclerosis. It's more common than Parkinson's disease.
Right.
The disease burden itself can be as significant and debilitating as that of congestive heart failure or chronic obstructive pulmonary disease,
Mm-hmm.
um, which we know are very debilitating. But
Right.
in our population, they are a lot younger,
Yeah.
which at the start of their lives is very inconvenient. And the silver lining, I guess, for us in
Yeah.
POTS research land is that COVID has long COVID
Uh-huh.
and also the COVID vaccine are both
Right.
coming up as being responsible for causing dysautonomia and POTS symptoms. So the
Mm-hmm.
prevalence, we still don't have great stats on it because
Right.
it still is under recognized and poorly diagnosed, but we do know that it is a lot more common. And it's a spectrum and it ranges from very mild, can function with lifestyle adjustments, right through to wheelchair bound, bed bound,
Wow.
can't deal with gravity.
Yeah. It's really incredible when you think about it because yeah, I think there was a while ago we were thinking this is rare.
Mm.
It's a rare condition and now like you said there has been some highlight with COVID and the vaccine. And then but now we're in this place where it's still very much poorly understood. I think we could probably agree
Mm.
that there's still a lot of work that needs to be done. So from the research, where do you see women most commonly experience gaps or challenges perhaps during pregnancy and birth?
There's three probably main areas that clinically crop up. There's
Mm-hmm.
the who is responsible.
Right?
Um, Quite often, women are told they're not allowed to have midwifery care or midwifery-led care,
Mm-hmm.
that it's too complex, that they need to go to high risk, which obviously limits options and definitely
Right.
affects continuity of care, which we know is so incredibly important.
Yeah.
There is the medication issue.
Mm-hmm.
People with POTS often have multiple specialists, and because we don't have guidelines that everyone knows about, which you will get as
Right.
part of the conference. But there aren't super clear guidelines. There's no
Right.
POT specific drugs. So what a
Mm-hmm.
cardiologist might say is safe, and the neurologist says is not, and then the obstetrician says something else. And there is a lot of fear around medication.
Sure.
And the third area is mode of delivery. So people are still being told that they'll need to have cesarean or cesarean's the
Mm-hmm.
safest when we actually know
Mm-hmm.
that that's not necessarily true, and cesarean should
Right.
only really be considered for obstetric reasons like anybody else.
Sure. Yeah. It's so interesting, that always seems to be a default when there's a sort of unknowns, right? So
Yeah.
that will be really good to have that conversation. And the fact that there aren't any, clear guidelines, and we know that medications seems to always be a conflict of medications from different practitioners. So it's going to be great to kind of dive into that and hear what you have to share, on a lot of that. I know part of your presentation and some of your work, just in getting to know you, you're very much for choice, and agency, and the hope that things can change. What do you most hope for our midwives, carrying this into their practice after attending this session? What is it that you really would love to see change?
I really believe that midwives are the change agents we need in this area. I'm really hoping that people come out of this feeling far more confident and not scared of POTS. And when you have a woman come to you, to be able to feel confident to say, actually, I can assess you, and yes, I can actually look after you in the
Hmm.
absence of, our serious, regular obstetric reasons to refer to high risk. I can look
Hmm.
after you, and I can support you, and I can help you make the choices you want so you can experience the absolute best pregnancy and journey into motherhood that you can. And I will be there to believe you and hold your hand and be part of that amazing journey.
That's incredible. I think, what I mean, with so many women out there, suffering, with this and not having solutions and being there's some harm happening too, because there's a lack of information. Um, the research itself, is it robust yet? Are we still in the early stages? Where are we at with the research, Kate?
With POTS and pregnancy specifically, the last I checked recently, there is 15 published papers ever in the
Mm,
academic literature.
right,
I think two of those are mine, which include the only systematic review and the clinical guidelines. There's some
right,
excellent reviews, clinical reviews that have come out from the UK and the US.
right.
Uh, but it's at a very slow moving area.
Mm,
And we are still, clinicians are still relying on very old, very outdated case studies from
hmm.
1992 when it was first
Right.
published. So it's very, very small, and I'm hoping to change that. We've got some papers in the works, we've got a new study in the works. So, yeah,
Well, that's what we love to hear. It's all about making change, right? It's going to happen
indeed.
right here. It's going to happen right in this presentation with you, because I know that people listening in, not only are they going to be keen to hear what you have to say, but being able to put clinical things into practice. But ultimately, there needs to be a drive and a demand. Obviously, as you said, it's not robust right now. We need to see more people taking this on and putting some things into action, and that will take a lot of us. So we need to come together. I'm feeling and sensing that from you. You are a leader in this area. And I'm definitely looking forward to hearing how you can pave that way for us. There's going to be something for all of us to learn and change, I'm sure, in our practice. Kate, thank you so much for being such a great voice to this. It's going to be amazing to hear, the things that you've learned on this journey and what you see for the future. Thank you again for joining me here today.
Thank you so much for having me, and thank you everyone for being interested in this topic and being the change.
Yeah, absolutely. And the good news is you can come and listen to Dr. Kate Levick live at our Gold Midwifery Conference. This gives you an opportunity to really sit down with your peers, with Kate, and be able to ask those questions, look at all the research that is available, and some of those changes that need to take effect. So don't miss out on the opportunity. Now, of course, if you can't come to live, it will be recorded for your convenience. We love that here at Gold, of course. And you will have the forums. And if you have any questions, you can always pop them in the comments below as well. Thank you again to Dr. Kate Levick for being with us here today. We will look forward to seeing all of you again. Head over to the website right now, goldmidwifery.com. You can check out this presentation, Managing POTS During Pregnancy, Empowerment Through Quality Care. We'll look forward to seeing you all online. Have a wonderful rest of your day, everyone. Bye-bye for now.